and Tally, and it kind of dovetails to what we have been talking about locking medication. She asks, how can we encourage behavior change for people to start locking their meds after they have been educated on the topic? What kind of messaging can we use that will be effective? In other words, how are we going to convince people to actually lock the meds, even though they're educated as to how potentially dangerous it is to keep their medicine cabinets unlocked?
$1 million question.
Yeah, I mean, I think that's what we're trying to do.
You know, Ray, sometimes legislation, you know, we don't do things until we're forced to do it. You know, certainly when we talk about patients with cancer or who are receiving chronic opioids, one of these little boxes, you know, $20 dispensed along with that, I think would go a long way, you know, towards helping secure these within homes. But again, you know, sometimes it takes, you got to do it, you know, rather than it being a choice.
Well, we hope that.
Excuse me, Ray, do you think there's an opportunity that as a coalition that we could inquire with all the health insurance carriers that a box like Mark alludes to is now a prescription quality, refundable, reimbursable event? So you go and you pick up, you know, a script of opioids and it costs you a $7 copay because you have really good insurance. You can't get it unless you get a drug box with a $10 copay. And now every time you fill a script that's a narcotic, you get one of those drug boxes with the script. I mean, that's a grassroots event that you take up through your legislature, and hopefully we can get that through. That would be a great opportunity for the CARE Coalition, the DA's office, health community to get behind.
I agree.
And I think that you would find that it's cost effective too. You know, I mean, if you think about what does an overdose cost? You know, if the patient ends up in the ED or they get admitted or, you know, ICU care, just one episode, you know, I think that would be cost effective.
Just as an incentive, perhaps for people to think twice about this and perhaps locking up their medicine cabinets, the CARE Coalition here in West Springfield, which is sponsoring our discussion this evening, is going to be offering a before and after social media challenge. And basically what this involves, they're going to be asking you photos of your medicine cabinets before locking up and then after, and then they will be awarding prizes through a drawing, just to step up the challenge and perhaps make people think twice about this and maybe give them a little incentive if they want to get involved here and win a prize for a before and after picture for, you know, before locking up your medicine cabinet and then afterwards. So that's